Thank you for joining us today. I'm Karen Blum. I'm the Health Beat Leader for AI and Patient Safety for AHCJ, which is a new area that we are focusing on. This webinar is one of a series of topic-specific training opportunities to brief health journalists on the latest information in a particular health area and to give you story ideas and resources that you can use in your work. Today's topic is understanding ChatGPT Health, how large language models are being used to triage care. So by now, I think most of us are familiar, at least a little bit, with ChatGPT. This is a generative artificial intelligence chatbot that can generate human-like conversation responses in response to prompts from users. Many patients have been using ChatGPT to help answer their health questions for themselves by typing in symptoms or asking about different health conditions. Many clinicians also have been using ChatGPT to help with parts of their jobs, and we're going to be talking about that during our conversation today. So I'm going to introduce our panelists. Rachael Robertson is an enterprise and investigative writer for MedPage Today and wrote a recent article on what doctors need to know about ChatGPT Health. Henry Bair is an ophthalmology resident at Wills Eye Hospital in Philadelphia, and he has written about health policy and digital health for publications, including JAMA Pediatrics and Stat News. And I'm also pleased to welcome Alvira Tyagi, who is a medical student at the Icahn School of Medicine at Mount Sinai in New York City. Alvira, nice and timely for us, co-authored a study in Nature Medicine that highlighted some of the shortcomings of ChatGPT Health that has been getting a lot of attention in the press, and we'll talk about that today as well. So we're going to have a little bit of discussion and then take your questions. Please put your questions in the Q&A box so that Kevin, our IT person, and I can see that. And we are first going to get started with some terminology. So there's regular chat GPT. And then earlier this year, OpenAI, the company behind ChatGPT, launched ChatGPT Health, which is a feature that allows users to connect data from their medical records and wellness apps to address health questions. And my understanding of this is still in beta testing, where people can get on a wait list. But according to their website, it says users also could connect information from laboratory testing or even the All Trails app you might put on your phone so they can find local hikes. If they're a Peloton user, if they're an Instacart user, upload information to look at meal plans. And then just to make it a little more confusing, they also launched ChatGPT for healthcare, which is designed for healthcare workers and or healthcare clinicians and has information like templates for discharge summaries and patient instructions. But today we're mostly going to be talking about regular ChatGPT and ChatGPT Health. All right, so let's get started by getting a sense of how many people are using these platforms. And Rachel, you had some statistics about that.
Yeah, so OpenAI says that 230 million people every single week use regular ChatGPT health use regular ChatGPT for health-related inquiries. As for ChatGPT Health, they haven't told me the information yet. I asked them, and the company didn't respond. But again, it's in really early stages, and you still have to get on a wait list in order to even use the platform. So I'm sure the number is much lower, but a higher percentage of people using it for health
Mhm.
inquiries.
Yeah, and let's talk about what are some of the ways that patients are using either ChatGPT or ChatGPT Health. I guess Elvira or Henry, what are some of the things that you're seeing?
So this is very common nowadays. Rachel alluded to the sheer scale of it, but it's if you think about just the publicly available information, ChatGPT has like 40 million daily users, and like by the company's own admission, like 1 in 4 patients ask it some kind of health information, interact it, not just ask a question, but have conversations about healthcare, like on a weekly basis. So that's millions and millions and millions of health encounters in a sense. Um, that actually dwarfs the number of in-person clinical encounters that happen in America every day, which is about
Mm.
3 million. So that's just something to think about. It's like there are more health interactions happening through ChatGPT than in person on a daily basis
Mm.
in the United States. So some of the things that I see patients coming in with, most commonly symptom exploration, self-triage, um, patients interpret help use ChatGPT to help interpret lab results, imaging reports, clinical notes. Um, One of the more astute uses of it I've seen is to patients using ChatGPT to prepare questions to bring into the clinical encounter. That's actually, I appreciate that very much
Mm.
because ChatGPT is pretty good at guiding patients to ask the salient questions. And then we also do have patients use ChatGPT for second opinions. So those are some of the things that come to my mind.
Mm.
Is there anything else
Interesting.
to add?
Yeah. Alvira, do you have anything else?
No, I just wanted to echo, like, I at Mount Sinai, which is a huge health system, we see 6 million patients a year. So again, these like statistics about how many people are using it online is really staggering. And again, with the doctor shortage and, you know, how difficult it is to get specialty care appointments, these kinds of tools are really helpful for both, again, patients being able to interpret lab results when their appointment might not be for another month. Like Dr. Bair was saying, like being able to prepare for those visits because oftentimes, again, those visits are quick and you want to make the most time out of it. So a lot of patients are going to these tools as a way to most effectively use their time and again, just get those answers that they're hoping for as soon as possible.
Yeah. And Henry tells like how accurate, if people come in and say, oh, ChatGPT said I might have this, how accurate is the information that they're bringing in?
So ChatGPT is very good at generating generic explanations of conditions.
Hmm.
Uh, but especially with ophthalmology, so I happen to work in a fairly niche discipline. So even within my fields, there are common conditions that I see that don't have that much literature support out there and are somewhat contested in terms of management and diagnosis. So, is it accurate? Depends on the condition, honestly. It really does. But what I would say is I think that when patients come in having prepared for the visit with ChatGPT, I do feel like we can ask more in-depth, more, more in-depth questions,
Hmm.
just because patients already have the basics covered. For example, like something as simple as cataract evaluation, right? Cataract's the most commonly performed procedure in America across any specialty, super common. ChatGPT will give you everything you need to know about what to expect for cataract surgery, recovery, medications, all those things. But whether or not a patient's ready to go through cataract surgery is very, very individual based. It's on a very individualistic basis, right? Because what kind of lenses do you put in? Do they read more? Do they drive more? What's their baseline risk factors? What's their baseline vision? So there's just a lot more nuance to what ChatGPT currently can give patients.
Okay. Now, Vera, do you find that too? I don't know.
Yeah, I specifically have not been able to see it on the patient front since I'm still training to hopefully become a doctor. But absolutely, I mean, it was just rolled out. It was only available to people on a particular wait list. So there's so much more to be studied about its actual effects and how beneficial it is for patients. But for now, if it provides patients that comfort to have something to talk to again in that time that they're perhaps waiting to see their physician, a lot of us do see it as something that is beneficial as long as it continues to update and improve itself continuously.
Yeah. Yeah. And let's talk about what are some of the like pros and cons of using platforms like this. So, Henry, you said it is pretty good at giving you some general information. I guess are there, and you also, when we were preparing, you were talking about like how people, sorry, like the responses you get somewhat depends on the prompts. How can users get the best responses out of these?
Yeah, so several things there. I really appreciate that you set out this conversation by specifying the different types of ChatGPT. There's the ChatGPT general, which is a little bit like having a conversation with a very well-educated stranger, and then ChatGPT Health, which is like giving a very well-educated stranger your medical records and having them sort of sort them through for you. And then there's ChatGPT for healthcare, which is like enterprise, which is actually integrated clear like
Mhm.
into a few, very, very select few hospitals currently have it. And that has like all the regulate data privacy regulations
Mhm.
that you would expect. Those three are pretty different products for different types of use cases. So I guess here we're sort of more focusing on like the first two because that's just what most people have access to. Even most doctors don't have access to enterprise ChatGPT. In terms of pros and cons, I think I alluded to earlier, but health literacy, translating jargon, explaining lab values, summarizing notes in plain language. Those are things that you don't need necessarily a medical degree to do. You just need a very diligent, well-educated person who does good research, and that's kind of what ChatGPT is. Um, Other things I've seen patients use ChatGPT for, like you said, appointment preparation. For the clinician side, it's great at administrative reduction. So I would say that the most common use cases for clinicians in ChatGPT on a daily basis is summarizing notes.
Hmm.
So documentation, prior authorizations, discharge summaries for patients, things like that. What else? It's also really good at brainstorming cases, just because in medicine, you can't, a physician can't possibly know everything. We are great at recognizing common patterns. That's what a lot of clinical medicine is. It's pattern recognition. There are conditions that don't fit the pattern. And in those cases, ChatGPT is helpful as a brainstorming partner. So I know lots of clinicians who use that. And then summarizing the literature. So ChatGPT is great at extracting like real world data and guidelines and things like that. So it helps organize that for you. Granted, there's also issues of hallucination, which we can talk about later. But in general, it's like if it often can cite, you can prompt it to cite specific guidelines and sources in which you can verify yourself. But it just cuts out a lot of the time that clinicians
Hmm.
need to spend on doing research.
Yeah. Yeah, Alvira, when we talked to you about like some other ways that clinicians are using these platforms, you had mentioned like drug interactions was one.
Yeah, in my time shadowing physicians, I've seen a couple of them use it to, type in what pre-existing conditions a patient might have and which medication in that case might be most appropriate to treat that patient if there are several medications available for that condition, which often happens, which I think is a really valuable use case. I've also seen a lot of trainees, both medical students on their clerkships and residents be able to use ChatGPT as just a way to, improve their training, get more information when the overhead attending physician might be busy, talk through other differential diagnoses that they're thinking of for their patients. So it's kind of like an on-the-go training tool that you can have in your pocket. For any moment in the hospital where you're thinking a lot about your patients and the charts that you're seeing. So I see it as something that's also really useful as like our generation of trainees is starting to try to find our space in the field of medicine.
And I think you said rare diseases. I think Henry, you touched on this too, maybe like rare diseases, it could be helpful in that
Yeah,
space also.
yeah, especially when thinking about again those different diagnoses. Like Dr. Bair was saying, we are all kind of trained to look at patterns, but sometimes there are these cases that don't seem to fit a clearly logical pattern, and I think it can be a great way to kind of brainstorm and think through those different diagnoses, whether they may be more rare or more common.
I think it's funny also because that's also how models like ChatGPT work is they're also looking for pattern recognition. They just have a
Mhm.
lot more input and, a different kind of process for sorting that information into patterns, which is both what makes it so powerful and what also makes it so flawed because it's only going to be as good as the input and it's only going to be as good as the inquiry that you're making. And so I think that's also why it's important to be validating whatever comes out of it and double checking it. Whereas, something actually your co-author, Dr. Ned Carney, told me that I thought was really interesting is one of the things that makes it different is ChatGPT will give you answers, whereas if you Google something, it gives you links where you automatically have that like critical thinking triggered versus like it feeling like a conversation with a, like Henry said, a really knowledgeable stranger. So I think that's just like another thing to consider.
And what are the best ways, I guess, in your experience, or how how can people get the most useful responses? Like, what are the best type of prompts they can put in, or how much detail do they need?
I mean, in my experience using ChatGPT regular, I haven't had a chance to use ChatGPT Health. I'm still on that infamous wait list. Um, for me, what helps is not necessarily the initial question, but then continuing to nudge it and give it more information into the direction that I'm hoping to get from it. So that's personally what I have found useful, but I'm curious, Alvira and Henry, what about you guys?
Yeah, totally agree. I think that I never take the first answer at its face value, just because the first it's like a first draft of an essay. Like you need to refine it, and it's really in that refinement that you really get the most out of it. For example, like there are, and this applies for both clinicians and patients too. There are lots of conditions that have risk factors that are often totally unintuitive. Right, like yesterday, I had a patient who had uveitis, which is inflammation in the eye, and it hurts, and it's light sensitive, and all those things. Like 50% of uveitis has no known cause. But this person just we were trying to brainstorm, like what could cause like this kind of severe bilateral uveitis. And one of the things that we when we fed it the patient's profile with identifiable information removed into ChatGPT, it gave us like all the right textbook answers for the most common things being common. Yes. But then one thing that the attending noticed was like, wait, this patient has tattoos. Did you put that into the model? It's like, oh, I forgot. I put it in. And tattoo associated uveitis is a thing. And we all knew that. I knew that. I forgot to put that in. And
Mm,
if the patient was using this on their own, I really don't think they would have just
mhm,
like put that information in, because most people don't associate tattoos with eye inflammation. But there's a very clearly established link there.
mhm.
And that's what this patient had. So it's like examples like that. I see it on the weekly basis, right? They're not common, like all things considered, like amongst all the clinical conversations I have with ChatGPT, that actually makes up for a very small percentage, but it happens like 5 to 10%. And I think that's where the iteration really comes in. And I think that's where one of the shortcomings of ChatGPT is that even the best at the current moment, the best models can't tell patients what's important or not yet, right?
Mhm.
Because if the patient hasn't supplied that, ChatGPT is not going to say, by the way, have you noticed these things? Unless
Right.
prompted. There is a way to sort of prompt engineer it and sort of push ChatGPT to ask you the right questions and have a nice conversation. But again, that comes from a lot of iteration and a lot of experience.
Yeah. And another physician, when I was reporting a story on this recently, another physician had told me that sometimes the information that people get or patients get, it might not be incorrect, but it may not apply to them specifically, like a diet recommendation, but they don't need it because they don't have, whatever micronutrient deficiency that they're recommending or something like that. I don't know if you find that also, that, maybe someone gets information that's not wrong, but it's not specific to them.
Yeah, I agree. And I think that's if we were just compare ChatGPT and ChatGPT Health, that's the
Hmm.
biggest difference, right? Because ChatGPT Health is where you actually do integrate your own personal data. You
Hmm.
integrate data from your Apple Watch, from your labs, through Be Well, which is like their enterprise partner for like FHIR standardized health data
Hmm.
transfer, EHR
Right.
transfer. So FHIR is I forget what's fast healthcare interoperability resources. So by law, organizations holding your healthcare data have to share it with you through the FHIR API, and that's how ChatGPT Health gets your healthcare data. You
Hmm.
have to obviously authorize it to give you that. But
Right.
that's really the powerful thing with ChatGPT Health is that it is using your specific data. It
Hmm.
can it can find patterns from your data. For example, you notice that your resting heart rate is a little high today or this week or something. And ChatGPT is able to look at patterns from the past few months. Like, have you been sleeping poorly? What's your diet like? Because it's integrating with, MyFitnessPal, with Peloton. So all these things. So that's where the power really comes from. But again, it's important to realize, like at a fundamental level, ChatGPT, LLMs in general, it's really easy to forget. They don't know what they're looking at. They don't really know they don't understand what they're looking at. All they do is predict the most likely next token,
Hmm.
next word, right? So they're not so great at figuring out what's important and what's not for now.
Hmm.
I think it'll be interesting to see how ChatGPT Health specifically gets updated and evolves because the queries in ChatGPT Health are not being used to train regular ChatGPT. So I think it'll be interesting to see if it actually does become significantly better as that specific model is updated with the information from those queries.
Yeah, which is another point. We have one question coming in about privacy. I know you both touched on that. Um, that's what I was curious, like how secure is the information that people are putting in. So I was looking at the OpenAI site this morning. So it said that it keeps information in this new health channel separate. Users can delete their health memories at any time, or that additional layers of protection are built in. Is this something that can we trust this? Can the information somehow still be used elsewhere?
Yeah. So I think this is like where it's really important for users, for journalists. So the critical gap is that um, HIPAA only
Mhm.
governs covered entities. So that's like healthcare providers, health plans, clearinghouses, and their business associates. When a patient voluntarily directs their own health data to a third-party consumer app, ChatGPT, that app is not covered under T. It's not a business associate. HIPAA doesn't follow the data once the patient sends it to somewhere outside of the regulated ecosystem. And so once a patient's data lands in ChatGPT Health, they're governed by OpenAI's privacy policy and terms of service, not by HIPAA. So what that means in practice is there is no HIPAA breach notification requirements if the data is exposed. There
Mhm.
is no HHS Office for Civil Rights Enforcement. There is no standardized audit trail requirements, no minimum necessary standard limiting of what data is accessed.
Mhm.
The FTC has some authority over consumer health apps under the National Breach Notification Rule, but it's a much weaker framework. So I think for now, the way that the system is set up, I, if I were to use ChatGPT Health, I would assume that any information I give it is no longer private because
Mhm.
it's not. There's no legal regulation to make it private, to
Yeah.
keep it private.
And I
Yeah.
think as journalists, we can put pressure or at least point out opportunities where there could be architectural guide rails to protect people's data, to protect people's health within platforms like this. And I think that's something interesting in your research, Alvira, that you guys kind of explored some of the shortcomings of the platform as it exists right now and ways that like it could improve and hopefully will. And having outside people who are not associated with OpenAI doing that kind of evaluation is so important because you're going to have different amount of accountability and you're not putting a PR spin on it.
Yeah.
Absolutely. I mean, ChatGPT Health was released back in January, and we were just able to publish this study. And for us, we were thinking, like, throughout the time we were doing this study, like, there are people using this platform who likely don't know that, HIPAA is not guidelining this. And although it feels like it's secure, like, it was, I mean, still just open to like a small group of people and still being improved. So, definitely really important for journalists and people just doing research in this field to keep pointing out those shortcomings.
Yeah. So this is a good segue to talking about your study, Elvira. So, your study has been getting some attention in the press. You looked at ChatGPT Health, showing that it may fail to direct users appropriately to emergency care in some serious cases. And I understand you and your colleagues developed some clinical scenarios that you tested against the platform. Like, tell us, like, what are the types of scenarios that you came up with, and what did you find?
Yeah, absolutely. So we basically created 60 different clinician-made patient scenarios that kind of span 21 different medical specialties, ranging everything from, okay, this is like a condition that is safe to manage at home, something like a cold, versus you need to go to the emergency department right now. And like a case for that may have been very severe asthma. And we also, with that, changed different patient demographics in each of the prompts that we put in. So we varied by race and gender. We added in some social dynamics to see if we told ChatGPT Health, hey, my family member thinks that this is like very severe, or my family member thinks it's okay. And if you have those little, tidbits that a patient might add into a prompt, how does that affect the result you get, even if every single other aspect of the prompt is the same? We also added in a component that involved barriers to care, so transportation, having insurance, and telling ChatGPT help that to see if it triaged differently. So yeah, we had everything from like asthma to cold. We had postpartum care. We really tried to span, it was like over 20 medical specialties, and um, saw it in different types of acuity from low to very severe.
And how did ChatGPT Health do in terms of responses to these prompts?
Yeah, absolutely. So, what we described our findings as was an inverted U-shaped pattern. So, ChatGPT Health did the best in triaging the middle cases. So the ones that were moderately urgent, like maybe you should go see a doctor within the next couple of days. But unfortunately, we saw some significant failures on both the extremes. So the very non-urgent presentations and true emergencies. So for the non-urgent presentations, there was over triaging being done for over 50% of the cases. And then for the true emergencies, again, we saw under triaging happening by 52%. So more than half of the time, it actually recommended less urgent care than physicians would consider appropriate for that specific scenario. So really concerning because again, those are the types of, especially on the emergency end of things, those are cases that could result in a patient not seeking the care that they really deserve. So, and what was also really interesting about our results was that it wasn't that ChatGPT Health wasn't noticing that these were emergent cases. It did notice that they were dangerous, but it just would still reassure the patient and suggest waiting, even though it was, very aware that this was a significant healthcare scenario. So it seemed like there was some sort of issue of relating the triage to the specific diagnosis that they recognized.
And I'm curious, in the ones where you said like less urgent cases that it over triage, what are some of the things that it recommended that patients do?
It basically would recommend just over concern. I think this had something to do with them just not being able to understand that these were something that you could receive over the counter care for or something that just didn't need an immediate rush. So oftentimes it would advise, immediately go to the emergency room or immediately seek care. Whereas it was something that, again, given that our healthcare system is so strained, we ideally want patients to, not be seeking emergency care when they can, resolve this at home, ideally with family support or just by receiving over-the-counter medications. And for some reason, strangely, there was some sort of overreaction to a lot of those less urgent cases.
Okay. And in our preparing for this, you mentioned that you and your co-authors had been in touch with OpenAI, or they were looking to improve the platform a little bit.
Yeah, no, ever since the study hasn't published, and again, this just really speaks to like the value of journalism and research in this sphere. We've already had a lot of conversations with people across the spectrum, but OpenAI has also recently reached out to have a conversation. We've not yet had that conversation yet, but they do seem very willing to kind of speak to us a bit more about the studies. So excited for that and looking forward to, hopefully like the goal of this study was really not to say like never use ChatGPT Health. I mean, we're all clinicians, we're all in this field of medicine and are all really interested in seeing how these tools can be leveraged as we adapt to serving this growing population of patients. But it is important for us to recognize those limitations, and it's exciting to see that OpenAI is ready to chat about it.
Mm-hmm. Henry, I know you alluded to one of the issues that we've seen in ChatGPT in general, anyway, is hallucinations, or they call it, where some of the information or sources that you get back isn't necessarily correct. Will that still be an issue, or is that still an issue in ChatGPT Health, or is it less so because you have a more defined set of like a database that it's pulling from?
So that's a great point. I would say in general, ChatGPT has gotten significantly better at hallucinations. I remember using GPT-4 like early last year, and then 5 middle of last year, and then now we're like 5.4, I believe. Moving very quickly, and the quality has drastically improved. I would say that the possibility of hallucinations when it's working off of your own data, sure, it's probably minimized, but it's
Mm-hmm.
still pulling a lot of information from what it's trained on, like the public information it's trained on, from studies and things like that. And yes, there is still absolutely a chance for hallucinations. Like when you're not just asking it to work off your own data, but you're asking it to interpret things, you're asking it to find evidences. Like, it's like, for example, if a patient has, I don't know, cholesterol, LDLC, or triglycerides of a certain level, and you're asking, it's like, hey, what are the guidelines? What do the professional guidelines say about this or that? Or what do doctors in general recommend about this high value? There's a lot of ample opportunity for hallucinations there.
Mm-hmm.
Because again, it doesn't actually understand the question you're asking. right? It's just looking at the input. It's looking at the number. It's looking at the word triglyceride. It's looking at cholesterol, and it's
Mm-hmm.
combing its database to figure out like statistically what is most likely to pop up in terms of its
Yeah.
response, right? It doesn't actually know what cholesterol is.
Mm. Yeah, it's confusing. Um, and you, yeah, I think you had also mentioned when we were preparing for this webinar, you said something like 1 in 4 people already report some errors in their medical records. I guess how could that factor in some of these responses?
Yeah, that's a it's a fascinating like little realm of study where you just there have been lots of things like published in like major journals looking at just giving patients access to their notes and say, do you find any problems? And it's like 1 in 5 patients, 1 in 4, 1 in 5 patients who had access to their ambulatory clinic notes found mistakes. The most common errors were things like incorrect diagnoses, inaccurate medical history, medication allergy errors. That's pretty important if you're going to feed those things into an LLM, right? Something like 7% of patients actually found notes written on the wrong person, like wrong patient entirely. Um, and that's very
Yeah.
concerning.
Yikes.
And then a review of notes from across like EHR systems also showed that EHRs in general can like fail to detect roughly 1 in 3 potentially lethal medication errors. That was like a study from the University of Utah. And then 97% to 99% of emergency room doctors actually report entering data into the wrong chart like in the last 3 months. Um, I would say that's underreported just because it's by self-admission, but like underreported 97%. I was like, how much higher can you go? And then there's also lots and lots of data showing that more than half of all clinic notes are just copy pasted.
Mhm.
So you get what we call chart lore, which is things like that just are not true. And you ask a patient, it's like, hey, did you have this like penicillin allergy? And they have like no idea what you're talking about. And you look, or I've had patients like, so what was that? I asked patients about you had a open heart surgery, and they're like, I have no idea what you're talking about. And you go into the chart, it's like somewhere like 5, 10 years ago, this just like appeared in like some pulmonary note somewhere. And maybe
Mhm.
because modern day charts are digitized. And so it's like
Mhm.
this vault of thousands and thousands of pages
Mhm.
compiled by like hundreds of different authors. So it's really easy. I mean, I'd be shocked if there wasn't some person making some mistake in there at some point in the last 10 to 20 years. You know?
Oh my
Um,
God.
and again, ChatGPT doesn't know if it's wrong or right. It can't for now. It can't qualify what feels off and what's right, um, or what pieces of data are more important than others. So that is aside from just how LLMs operate, just the unreliability of a lot of medical records these days is a big concern. I spend a lot of mental energy when I look at charts, figuring out what's correct and what's relevant,
Mm-hmm.
what's not.
All
And
right.
then with the other capabilities of ChatGPT Health, like the integration with your wearables, the quality of wearable information can vary a lot by the model, by how accurately someone's wearing it, by how often they're wearing it. And so when you have that huge amount of information being added, like that's also shaping how ChatGPT Health is like shaping the answer, right? Like the information that's being input is going to shape the answer as well as how you're asking the question itself. So there's some limitations to adding that, even if perhaps there's also benefits, but
Mhm.
that's going to continue to require tweaking on the company's behalf.
Yeah, I put one of the links that Kevin put in our chat is there was a story a little while ago in the Washington Post from their former health tech columnist who uploaded some data from his Apple Watch to Chat GPT Health and said like, okay, give me a grade. How am I doing health wise? And it gave him an F. And he got concerned and talked to a doctor and said like who found some like little anomalies that the technology definitely missed and said he didn't have to worry. I think they upgraded him to like a B, but but the story's in there. Let's talk a little bit, Rachel. I want to hit on you. Let's talk about some of the advice for journalists in the audience. Where can we find story ideas in about ChatGPT? Where can we find some unbiased sources to talk to us about this?
Mm. So when I think about bias in sourcing, I kind of treat this how journals treat disclosures, where I want to know like what kind of relationships the sources have to AI companies. That's just like helpful to know. It doesn't mean you can't use them, but like, it informs how you can interpret the information that they're giving you. In terms of stories, something I'm personally interested in is when do these platforms escalate something to actual humans, right? Like a really interesting finding in your study, Alvira, I thought was about the suicide hotline and how it was really inconsistent on how long it would pop up when someone was putting in suicidal ideation. And, a structural guardrail there could be is like not letting the conversation go further, but like keeping the suicide hotline there, escalating it to a human who has to make a choice based on like human critical thinking and expertise. And I think stories on how the platform could be safer in that regard and how patient safety and patient data can be better protected. I think those are ways we can continue pushing to find more information and push the company to do better because companies, sure, they want to improve, right? But like it does take pressure to get them to make changes that really benefit the public. And I think that's somewhere research and journalism are really aligned on how we can continue pushing forward. So that's something I'm interested in personally. But it's just going to be changing so fast. Like right now, ChatGPT Health is still really fresh, but like Henry has said before, like the research on ChatGPT, it really depends on what model you're looking at, what time frame it was looking at. And so as it evolves really quickly, I think as journalists, we can help people keep tabs on like where is the status of a particular platform right now, and how is that different than before, and helping people keep that sorted.
And are there good questions? And when we're doing this reporting, what are some good questions to ask?
I always want to ask about bias because I think part of the tricky thing about ChatGPT and ChatGPT Health is it feels like you're talking with another person, but you're not. Like it is inherently limited and it can feel kind of authoritative. It can feel kind of like omniscient, but it's inherently limited. And so knowing where those limits are and where bias can find its way in through input on either the data end or on the inquiry end, I think that's something that I'm really interested in. But I also like to ask people like, where is there not research that there should be? Like, what questions do you have that you can't get an answer to? Because sometimes, a researcher has that question, but like a journalist can get a different kind of answer from a company or put pressure in a different way. And those are just a couple of like jumping off points that I start with.
Yeah, thanks. I appreciate that. All right, we're getting some questions come in, so I'm just going to ask my last question, at least for now. Are there stories about ChatGPT or ChatGPT Health that you're not seeing covered in the media that you think should be? I'll open that to any of you.
I haven't seen so much about the whole like ChatGPT launching advertisements yet. That's pretty new. It's just I think just a month ago. For like the lower tier, like the free users and like the Go tier users. And OpenAI says that the ads don't influence the answers and the conversation data is not sold. Users can opt out of personalization and that ads are not shown near quote like sensitive topics like health, mental health, or politics, and then no ads for underage users. That's what it says. But the concern is that like health is it's undefined in terms of like what do you mean by health product? What about a wellness product? What about a sleep product? Um,
Yeah.
so and then there's also like an inherent conflict of interest, I almost feel like, because ad-supported platforms like the whole point is it's to optimize engagement, not necessarily accuracy.
Mm.
So I haven't seen too much about that, but I think that is really interesting because I could easily see this sort of developing to two parallel tiers where you have like the the paying users, the enterprise users, the people who can afford more, getting like the ad free, even the more accurate experience, whereas people who don't have those resources getting like this ad subsidized, maybe less accurate experience. And that's if you scale that to a national level. So what we're talking about is that the people most likely to rely on free ChatGPT for a triage decision at, I don't know, 2 a.m. on a Sunday are the people most likely to not have insurance, not have primary care doctors, live in a healthcare desert, right? So these people, they get the ad-supported, least reliable version. So if, again, like this is kind of speculative, but that is not like democratizing healthcare. That's kind of just digitizing the disparity. So I think that's something that is really interesting. I want to keep an eye on.
I was going to say, I think it was kind of close to what Dr. Bair was saying at the end. I'm really interested in how we can improve healthcare access for older adults in the United States, especially as the population continues to age and we have a severe shortage of geriatricians. I'm really interested in understanding if older adults, maybe like 65 plus, are able to use the platform, are currently using the platform, and whether they found it beneficial, if they find that the platform is easy to use. So that's been a real interest of mine, especially since there aren't strong caregiving networks in the United States, and it's something that we have to put a lot more focus on. I'm also really interested in people using specifically ChatGPT Health potentially as therapy. I know there has been a huge influx of articles with ChatGPT and some really concerning cases of people using it as a therapist and potentially resulting in some really negative outcomes. I'm really interested in like whether ChatGPT Health could be a better fit for some of that initial support that could then lead to hopefully a real therapy appointment. But I'm most really interested in how well it's conducting itself as potentially a mental health support chat box. So those are kind of two of my own personal interests that I would love to see more on.
And then also, I think as we see more adverse outcomes happen tied in some way to ChatGPT and ChatGPT Health, I'm interested to see how the legal system adjusts and how legal precedent is set because things are changing so fast. But like kind of drilling down where is accountability, who ultimately is responsible, and what are the limits of that? I think it's kind of porous right now because things are changing so fast. And, the law is notoriously slow and technology is notoriously fast. And I think that's an interesting tension where I'm not sure if there's necessarily an answer, but I think it's something that we need to be paying attention to.
All right, we're going to go to some of our questions here. It says, why can't we customize, or I guess, can we customize ChatGPT to look only in PubMed? Like, can you define what it looks in? I don't know if anyone has the answer for that.
Yeah, you can just say only look at, in articles indexed on PubMed.
Okay.
But again, it doesn't really know what PubMed is, right? Which means it can hallucinate. So ChatGPT is extremely good at mixing and matching like real and fake citations. Like you'll have the author is correct, the title's correct, but the article doesn't exist for some reason. Or you'll have like just wrong links, wrong page numbers, wrong volume numbers. You'll have you'll have like a sentence and then it'll insert citations, but like a third of the citations are made up. So unless you're really diligent, like clicking through all of them, and once you click through them, like you have to have the patience and some of the clinical knowledge to actually understand what the primary sources are getting at, right? I think that's a huge vulnerability. So theoretically, yes, you can specify it, but again, it has all the trappings of hallucinations that we've discussed.
Okay. Says, do clinicians have to ask patients if they can use ChatGPT since it's open and not applicable to privacy rules? I don't know.
So could you repeat that again?
Yeah, it says, do clinicians have to ask patients if they can use GPT?
Do clinicians have to ask patients if clinicians themselves can use ChatGPT?
Yes.
Yes. So clinicians are committing HIPAA violation when they use when they put patient information in GPT without de-identifying it. And that's actually like a whole other thing. I know that Rachel and we discussed about the use of shadow AI. And that's where is clinicians using ChatGPT just to put questions. They'll just copy and paste wholesale, like the whole patient's note into ChatGPT. That's a HIPAA violation. And to the best of my knowledge, I think that's actually how a lot of clinicians are using it. I'm not going to say most, but A lot of people I see using it, they don't bother going through and like deleting the patient name, date of birth, things like that.
Like de-identifying, yeah.
Yeah.
And that's where health systems also could catch up in making like more clear
Yeah, rules for
guidelines
their
for their
employees.
own employees. Yeah.
Yeah. What are the major federal or state regulatory fights that you're paying attention to when it comes to AI in healthcare? Are there parts of the industry that have higher stakes in terms of guardrails?
Could you repeat that? Sorry. I was
Yeah,
trying to see if I
no,
could
that's
see
okay.
that in the chat.
No, that's fine. What are the major federal and state regulatory fights that you're paying attention to when it comes to AI in healthcare? Are there parts of the industry that have higher stakes in terms of guardrails versus innovation?
To be honest, that's kind of outside my beat. So
Yeah.
that's something
Yeah,
I
I
could
don't,
be paying attention to, but I don't know a ton about it.
yeah, I don't know. I guess who's regulating this, or is it being regulated? That's the question.
Yeah,
There's
I mean, I feel
five
like this is also
regulations.
something I don't know a ton about, but I will say I think it's just been like a huge kind of I think what I've been seeing a lot of is like Mount Sinai, struggling to figure out and doing so well, but like trying to figure out like its oversight over these tools in like their healthcare system versus then like New York State having oversight and then the federal government. Like it's a classic scenario of like who should be in charge.
Mhm.
Should another interesting conversation I was having with a clinician was like, should individual clinicians be able to decide like how much they want to involve a tool in their care? Or is it something that would be standardized across, all clinicians using AI tools to, for example, transcribe their notes for patients which often takes up a lot of time in their documentation and takes away from time they could actually spend with patients. So there's a lot of like, where do clinicians have their own personal oversight versus the hospital system versus the state? But definitely something worth looking into. I actually feel like there's just more conversation that needs to be done. I think that people are a little bit hesitant to like take a firm stance since every day the technology is evolving. A new tool like ChatGPT Health is dropping. So I think it's just going to be a space that we'll have to keep an eye out for the next couple years.
All right, another question. Can you address how long-term bias in medicine might also be reflected in AI health advice?
Yeah, so there's a lot of bias in medicine, and to some degree, this is an extremely nuanced point. I can see people arguing both ways. So, for example, we use racial criteria to determine risk factors. So, in my field of ophthalmology, there are associations with minority groups with having greater proportion of greater possibility of developing glaucoma. So we actually have different glaucoma screening criteria. And then same thing for these cardiovascular risk factors, same thing for macular degeneration. And you can argue that this is like we said, medicine is clinical. Medicine is pattern recognition. This is just pattern recognition. But you can also argue that, well, if you're assuming things, if you read too much into it before you even meet the patient, and then you sort of let those preconceived ideas influence how you talk to a patient, that's not great either. So yes, there's a lot of established guidelines out there that have um, racial implications baked into it. And that's most of the corpus that GPT is trained on. There are a lot of efforts. I do see like revised guidelines that try to take that out or look at, is there something else? Like instead of racial minorities, is it actually like a zip code? In which case, yes, the answer is yes. It's actually more associated with zip code, more associated with diet and things like that. But for the longest time in medicine, race is just the most easily recognizable and quantifiable metric in a patient. Now it's getting better, but like I said, ChatGPT is mostly trained on the older stuff.
Mm-hmm. Do we have any data on how frequently clinicians are using ChatGPT? All right. Well, and how would a patient know if his or her clinician has consulted ChatGPT?
I think it's all self-reported. There's no actual published data. I would say the published unofficial surveys usually show like 40 to 50% of clinicians say they use ChatGPT or an LLM of some kind. I think it's higher. I think it's
Yeah.
like 90, 95%,
Yeah.
just
The
anecdotally.
statistic I'm sorry. Sorry. The statistic I saw most recently, I think it was that approximately like 65% of physicians reported, again, self-reporting,
Mhm.
reported using ChatGPT in like 2024, 2025, which was up from 35%, I believe, the year earlier. So it's like not only pretty high, but growing by the year. And I'm sure again will increase as more of these healthcare centric GPT tools kind of come out.
And this is, I'm just curious, is that something, are people open about saying that they use it, or is it still something like sort of secretive?
It's changing a lot. I
Yeah.
think it's actually changing. I think like even as of last year, people sort of kept it on the down low, because it almost felt like I was cheating. But
Hmm.
not anymore, genuinely. Like when I see hospital teams like round, like in the morning in the hospital, people do cite, not don't cite, but they refer to searches that they have. I think it's increasingly being seen as just it's a tool. For
Hmm.
example, like in medicine, we've long used I mean, we long use like systemic studies or scoping reviews to summarize the best evidence. We use Google to search for things. We use calculators. We use clinical risk calculators. And I don't know if at some point maybe any or some of those things were like seen as cheating, but they're now all very widely accepted as just ways to make your decision making faster. I think that's the direction we're heading in.
Yeah. And how would a patient know if their clinician has consulted ChatGPT? I guess beyond asking, right?
Yeah, I don't think it's a regular part of patient visits yet for clinicians to come out and say, "Hey, by the way," I'm sure if a patient asked, they could get an answer, but it's definitely, and again, I think this just speaks to how quickly everything is moving. It's definitely not commonplace for that to be something that's outright said. So it is really interesting, and it'll be interesting to see if that will become something that a physician may have to disclose. But again, with patients use it or physicians using it increasingly so it's funny I'd almost assume that probably my physician has used ChatGPT at some point of my care, whether that be before, after documenting my care. So yeah.
Interesting. Henry, question for you. It says, you touched on this already, but how much pressure do these models put on users to be medical and media literate to use them to their full potential? Like that you can discern between good and bad sources, you ask the right questions, etc.
Um, Pressure. That's an interesting word. I don't think it does. I mean, you can ask it to you can prompt ChatGPT to give you the information at whatever level you want it to. You can have it say, explain it like I'm a first grader, third grader. I mean, we'll use more words to do it. It'll draw analogies, which are sometimes pretty good. Um, I don't think there's a pressure there. I think it's a lot of it is very on a meta level where it's like you sort of have to have a certain degree of medical familiarity to know that you need to be asking it more.
Hmm.
So I think that's inherently where one of the biggest risks of patient usage comes from, especially if they're again OpenAI is so clear. It's like this is not a diagnostic tool, um, but that's what patients are using it for. Um, so yeah, so, I mean, again, I'm all the examples I have that come immediately to mind are like in ophthalmology, but like we see flashes and floaters a lot, right? So patients can usually think of the word flashes and floaters, but like when I see that, I know enough that there are many different kinds of flashes and floaters. Is it like off to the side? Is it in the middle? Did it last for a few seconds? Did it last for a few minutes? Did your vision black out? Did your vision go blur and white? Because all those things have complete will send you down completely different diagnostic pathways. But patients might not know those terminology. They might not know how to describe flashes because a flash of light is a flash of light. If you put that into ChatGPT, it's going to tell you you might have retinal detachment, go to the emergency room, right? But like if your flashing lights were somewhat in the middle, they were in both eyes and they lasted for 5 minutes instead of 5 seconds, and they were accompanied by some blurriness in the side over here, then you might have an ocular migraine and you might instead need an MRI of the brain. That's totally different. But like most people don't know to ask to clarify those things. And as of now, ChatGPT does not prompt patients to clarify what they mean by certain symptoms. That could change, but not right now.
Okay. All right, we're winding down on our time here. So let's maybe go around and just say, like, if you had sort of a main take-home message that you want to give us about using these platforms, what would you say? And I'll go through, I can go through all of you. I don't know, Rachel, do you have like a take-home message for us?
Yeah, I mean, ChatGPT is here to stay, and it's a tool where I think, regardless of your profession, I think it's helpful to know how to use it, how to manipulate it, how to validate the answers, and then how to question whether what you're getting is accurate, and how bias on the platform's end or on your input end are shaping what you're getting out. Um, I think that's my big takeaway here.
Okay. All right. Alvira, do you have a takeaway message for us?
Awesome. As someone who's like starting med school, I'm a huge proponent of trying to keep up with these tools versus trying to catch up with them. And I think that that's something that's an interesting tension that current trainees in medicine have is both learning how to do clinical care as, you know, a clinician without these tools in your view, but also realizing that these tools are developing with us. And so I really encourage trainees to be really focused on still being aware of these tools, using them to whichever degree they want, but to again, to Rachel's point, they will stay here. So knowing what tools your patients will be using, even if you yourself maybe don't use them, is going to be so important for having important conversations with your patient. So I think just staying on top of these tools versus the catch-up game is kind of my take-home message.
All right. Henry, your last words of wisdom for us.
When I was preparing for this conversation, I keep coming back to, and I did mention this point like the first 5-10 minutes of our conversation, but our current healthcare system handles about 3 million clinical encounters a day. We've built, or OpenAI and its ilk, have built an AI chatbot that handles more than 2 to 3 times that volume of health interactions daily. But it has no clinical training, no licensure, no malpractice liability, no regulatory oversight, no independent safety evaluation prior to launch. ChatGPT, people think about it as a supplement to the healthcare system, but at the scale it is now, it's a parallel healthcare system. It's one that operates entirely outside of the regulatory, ethical, and safety infrastructure we spent the better part of a century building for modern American medicine. And unlike most doctors' offices, it's available 24/7 for free. So all that is to say, it's here to stay. What I just summarized there kind of makes me sound like a Luddite. I'm not. I feel like that's just these are things that you have to be aware of when you use them. I use them. I know patients use them. I like it when patients use them. But just understanding that it's not just like some miracle thing that's going to solve all your problems, right? Like this pace at which ChatGPT Health was launched, and then Alvira's team studied it within a few weeks. That pacing, like the release, the widespread uptake, the studies showing it is mind-boggling if you think about that. Most traditional healthcare tools or devices or medicines take 10 to 15 years from development until like post-market surveillance, and we just crammed all that into a month, right? So I think just pulling back and looking at the context where it sits within how other things have developed, how other technologies have developed is probably my takeaway.
Okay. All right, great. Thank you so much. Rachel, Henry, Alvira, thank you so much for sharing your expertise and your time with us. I also want to thank everyone in the audience for tuning in. There are a lot of demands on our time these days, so I appreciate your fitting this in. If you joined us late, you'll find the recording of this webinar available at healthjournalism.org in just a few hours. AHCJ will continue to bring you webinars on a variety of health topics as a perk of your membership. And you can join us next week, March 17th, for our next webinar on the ACIP meeting countdown and vaccines, hosted by my colleague Tara Haley. Have a great rest of your day and good luck on your stories.